Hello, the following information will be about the radio-frequency ablation tool, as presented by Alexa Espino, Ali Garcia, Janine Casey, Jessica Walla, and Carson Rossi. So what is the radio-frequency ablation tool, also known as RFA? This tool is an FDA-approved piece of equipment that can be used in minimally invasive procedures to treat tumors of the liver and kidneys. RFA utilizes localized heat to non-surgically shrink tumors. This tool is typically used for tumors that are inoperable in the kidneys and liver. This non-surgical treatment is used for the purpose of palliative care for those living with cancer and to increase their quality of life. As tumors within these areas grow, it can become painful and they can press against vital organs and nerves. RFA can alleviate this pain and improve the quality of life for those living with cancer. This current technology of RFA is effective for small to medium-sized tumors in the liver and kidneys. As RFA technology progresses, it may be possible to be used to treat larger tumors in the future. RFA is a minimally invasive alternative to surgery. The tip of this tool emits a radio frequency that creates heat to shrink tumors, while leaving the healthy tissue unaffected. During this procedure, an interventional radiologist inserts a small needle into the area of interest. The tip of the tool emits a radio frequency. This frequency creates heat. The heat then shrinks the tumor. Over time, the body absorbs and excretes these dead cells.
Radio-frequency ablation is commonly used in ultrasound and computed tomography, known as CT. Ultrasound uses real-time imaging which aids in the detection of tumors. It plays a role in the guidance and adjustments of the probe during the procedure. CT uses something called multiplanar reconstructions, which creates cross-sectional images from various angles, and this will significantly enhance the diagnostic accuracy. CT can rule out any connections a tumor may have with their surrounding organs, and both modalities of ultrasound and CT can be used as a combined procedure. Radiofrequency ablation is beneficial to the patient because it is less invasive. It also aids in pain relief, and there's a decreased need the patient will need any type of pain medication. This usually does not require any type of general anesthesia. There's very little discomfort following the procedure, and minimal side effects or complications are associated with the procedure. There's little to no recovery time, so the patient can get back to their regular activities and regular routine within 24 to 48 hours. It may be combined with other treatment options such as chemotherapy, and has a high success in stopping further spread of cancerous cells. Clinical indications that are associated with radiofrequency ablation. It is commonly used as part of a cancer treatment plan and initially used to treat lesions of the liver and the kidneys. Other cancers can utilize radiofrequency ablation, such as breast, bone, lung, and prostate cancer. Additional reasons for the use of radiofrequency ablation may be for the use of chronic pain associated with arthritis of the spine, spondylosis, and sacroiliac SI joint pain. Pain in the neck, back, and the knee. Facial pain is caused by trigeminal neuralgia, peripheral nerve pain, and heart rhythm problems. In the photo here, it shows a CT scan showing radiofrequency ablation of a liver lesion.
Hi, I'm Ali, and for my part of the project over the radiofrequency ablation tool, I researched how the procedure was actually performed. During my research, I found that this tool is very diverse. You can use it for nerve damage in your spine. You can use it for arthritis. There's lots of different ways that you can use this tool, but our project is centered around the breaking up or kind of destroying of cancerous cells and tumors. And so when I looked it up, and did some reading, I found that first your doctor will send you as a patient to the radiology department to receive images. So you'll get x-rays so they can see exactly where your tumor is, how large it is, assess things kind of like that. And then you'll come back whenever obviously your procedure's scheduled for, and you will, the procedure is actually done in the radiology department because the tool to guide it, they don't cut you all the way open. It's a minimally invasive procedure. The very tip of it's like a needle tip of the tool will be inserted through your skin into the body part where your cancerous tumor is. And so, like, say, for instance, if it was in your kidneys, you would be lying prone on the table, and they would be using the fluoroscopy machine to guide the tool to be able to actually perform the procedure. And so you get to the radiology department, you would get all set up. I read in multiple different places that depending on the procedure, they'll give you some numbing cream to numb the area before they insert the tool. And then they will, some procedures said that they use light sedation. And some said that they would just give you maybe a Xanax or something to calm your nerves, because apparently it doesn't hurt that much. But I would assume for a longer procedure like a kidney tumor, things like that, that you would probably be given some sort of sedation, just because it would take a while and it probably does not feel great. The actual tool, when it's inserted into you, will heat up, and it heats up all the tissues surrounding, and the heat causes the cancerous cells to die. And so this is really, really great for patients that don't really qualify for actual surgery. Like, maybe you have other conditions, or maybe it's really hard for elderly people to get surgeries because it's harder on their bodies, things like that. So this is a really good kind of other option that you can have to help with things like this, like cancerous tumors and things like that. I attached a link in this little orangish yellowish little circle, and it is a pretty lengthy video. It's 58 minutes, but I watched it because I thought it was so interesting how they did this because I've never even known about this or heard of it. And I thought it was really interesting, and it seemed to go really well, and it was really smooth, and it was interesting to see how the radiologist and everybody worked together to do this procedure on this tumor for this woman. So yeah, thank you.
Okay. What do we do as radiologic technologists during the RFA procedure, and who performs the RFA procedure itself? So our role as a radiologic technologist in the RFA procedure is to use sonography or CT in order to guide and find the tumor that is being ablated. Once the tumor is located, further guidance is needed in order to place the needle and electrode within the tumor. So who can perform the RFA procedure and why? So typically RFA is performed by a doctor who is trained to do so, but any personnel can perform this operation if they have gone through an accredited training program. Courses take about 3 to 4 weeks to complete. Here I have some images, one image of a sonographer locating a tumor, and this picture right here is just a general RFA training course brochure. So patient instructions for before and after RFA. Before RFA, the patient should get routine blood work, certain medications should be halted, and food and drink should be avoided for a certain period of time. Now, after RFA, the patient will be delivered or taken to the recovery room. They will be prescribed a pain and nausea medication. A one-night stay in the hospital will be necessary. After they leave the hospital, they will be asked to halt exercise for up to 1 or 2 days, and a CT follow-up will be scheduled.
So what are complications after the procedure? Some complications for radiofrequency ablation that are common throughout different types of procedures are hemorrhage and infections. However, procedures specific to tumor removal can include different complications, which include intraperitoneal bleeding and pleural effusion, and these are some of the more severe complications. What are the follow-up exams if needed? Typically, the patient does a follow-up after 12 months. This is to monitor tumor presence. If there are no incidences of tumors found, the patient is then periodically monitored, which is typically within the next 5 years. What are modifications to the patient lifestyle? There is short-term modifications done after radiofrequency ablation. This is typically 24 hours after the procedure. The patient takes this time to rest, and this is to ensure the best recovery. There are also long-term modifications, which include the patient maintaining a healthier lifestyle. Things such as exercise and diet are important aspects that help prevent future complications.